Hi, my name is Brittany Johnson. I'm here today to perform the head-to-toe assessment. With me today I have a 27-year-old male. Prior to beginning the examination, we have reviewed the patient's past medical history, surgical history, family history, allergies including drug allergies, environmental allergies, and seasonal allergies. Patient denies any complaints today. We have taken the patient's vital signs, which are all within normal limits. We've also tested cranial nerve number 2, which is the optic nerve, by having the patient review a Snellen eye chart. Patient has 20/20 vision without the use of corrective lenses. When walking the patient from the waiting room to the exam room, I observed the patient's gait, noting that the patient's gait was stable. He was able to walk on his tippy toes as well as his heels without any balance disturbances. Throughout this examination, I'm going to be taking a look at the patient's skin, noting moisture, color, texture, looking for any signs of rashes. I'll also be inspecting the nail beds, making sure there's no signs of cyanosis, also inspecting for moles, rashes, and inspecting that in further detail if found. I'm going to begin the head-to-toe assessment. Just going to start by general inspection, taking a look at the patient's face, making sure that the eyebrows are symmetric, that the eyes are symmetric, as well as the ears. I'm going to take a look at the patient's scalp. I'm going to go ahead and feel for the scalp, noting any nodules, tenderness, also looking at the hair distribution to make sure that the hair distribution is normal. Brett, do you have any tenderness? Okay. I'm going to go ahead and palpate the temporal pulses. Pulses are 2+ bilaterally. I'm going to take a look inside the patient's eyes, noting that the sclera is white and shiny. There is no signs of discharge, inflammation. I'm going to take a look at the conjunctiva. Brett, I'm going to take a look inside your eyes. Great. Noting that that conjunctiva is nice and pink. No signs of jaundice, which could indicate liver failure and hepatic failure. We're going to go ahead and take a look inside your eyes. Great. Brett, I'm going to brace my hand on your forehead just for stabilization, okay? Great. I'm able to see that the patient has a red reflex. The disc margins are sharp. There's no signs of blurred disc margins, which could indicate papillary edema. I'm going to go ahead and test cranial nerves 3, 4, and 6, ocular, motor, trabecular, and abducens. We're going to do this by testing the fields of gaze. Brett, I'm going to start midline, and I'm going to have you keep your head straight and follow my pen light, or my pen. Great. You can also go ahead and check for pupillary reaction. Brett, I'm going to shine a light in your eyes. I'm just going to make sure that your pupils dilate and then constrict at the same time, okay? I'm going to have you focus on an object at the back wall. Okay, I was able to note that both pupils constricted equally from 3 millimeters to 1 millimeter. Perfect. We're also going to check the patient and make sure that he's able to constrict eyes equally. Brett, if you can focus on the back wall and then follow my pen in. Great. That's testing accommodation, making sure that the patient is able to follow the pen line all the way in, which he was. We're going to go ahead and palpate the sinuses starting at the frontal sinus, making sure that there's no signs of any sensitivity, and then also the maxillary. Any pressure? Good. We're going to go ahead and take a look at the ears. First, I'm just going to palpate the auricles of the ears, making sure that there's no nodules, tenderness. You can also take a look at the tragus, making sure that there's no tenderness, and as well as the pinna. I'm just going to take a general inspection of the ears, making sure I don't see any discharge, swelling, anything like that. On a male adult, we're going to go ahead and pull back on the ear. I'm going to take a look inside your ear. Alright, I am able to visualize that tympanic membrane, which is pearly gray, and also the cone of light. I don't notice any signs of bulging, redness, or drainage inside the ears. Great. At this point, we're going to go ahead and test cranial nerve number 8, the auditory nerve. Brett, I'm going to whisper into your ear, and I'd like you to repeat what I say out loud, okay?
22.
Great.
44.
Great. I'm going to go ahead and inspect this ear. We're going to pull back on the ear and take a look inside. Great. Once again, able to visualize that tympanic membrane, which is pearly gray, as well as the cone of light. At this point, I'm going to go ahead and test Weber and Rhine. With Weber, we're testing lateralization, making sure that the patient is able to feel on both sides, and with Rhine, we're testing air-to-bone conduction. Okay, Brett, let me know if you can feel this on both sides.
No.
Okay, let's try it again.
Okay.
Perfect. And then we'll test Weber and Rhine. Let me know when you stop hearing this.
Okay. Okay.
Great. Air-to-bone conduction was noted. I'm going to go ahead and go back to the nose, taking a look at the nasal, making sure that it's midline. We're going to test patency of the nares. Brett, I'm going to place a finger on your nose and I want you to blow out. Great. Good. I'm going to take a look inside the nares, making sure there's no signs of any nasal polyps, lesions, making sure that midline is septum in the nose. Good. I'm going to go ahead and test cranial nerve number 1, the olfactory nerve. Brett, I'm going to place something on your nose and I want you to smell it, okay? Can you tell me what that is?
Alcohol.
Okay, can you smell that bilaterally?
Yes.
In both nares? Great. You can open your eyes. Okay. Now I'm going to take a general inspection of the mouth. I want to see a pink mouth. I don't want any signs of cyanosis. I'm looking at the moisture of the lips, making sure there's no cracking, scaling. Let me get my light. Brett, can you open your mouth for me? I'm taking a look at the hard palate as well as the soft palate. Great, and then have you lift your tongue up. Also going to look at the floor of the mouth, making sure that the vascularity is good. And there's no signs of lesions where a lot of cancerous lesions can occur. I'm also noting dentation, making sure that there's no signs of cavities. I'm also going to take a look at the gums. Good. Great. While I'm here, I can go ahead and test cranial nerve number 9 and 10, the glossopharyngeal and the vagus. All right, Brett, I'm going to have you stick your tongue out and say ah.
Ah.
Great. I noticed that that uvula rises symmetrically. Now we're going to test the vagus nerve. Are you able to swallow easily?
Yes.
Great. I'm also going to feel up here. Any coarseness? Okay, good. Good. Those are tested. We can also go ahead and test cranial nerve number 7, the facial nerve. Brett, can you smile for me? Great. Can you puff out your cheeks? Great. Can you raise your eyebrows? Good. Cranial nerve number 7 is intact. We're going to go ahead and palpate for the cervical lymph nodes. I'm going to start with the preauricular. Let me know if you have any tenderness noted. The postauricular, submandibular, submental, cervical, postcervical, and supraclavicular. Just noting if I feel any tenderness, any nodules that are enlarged. Do you have any tenderness? Great. I'm going to go ahead and test the spinal accessory nerve. Can you move your head side to side? Great. Can you shrug your shoulders? Good. Patient's able to shrug his shoulders. and that looks good. While I'm here, I'm just going to take a general inspection, making sure that that trachea is midline and that it's not deviating. I can also palpate the sternal notch and feel for that. I don't show any signs of deviation. I'm going to go ahead and palpate for the thyroid. We're going to do this from behind the patient. I'm going to put my hands behind you and I'm going to have you swallow. Good. I don't feel any signs of hard nodules, any abnormalities noted with that thyroid. We're going to go ahead and test some coordination. Brett, I want you to put your hands on your lap, and I want you to go back and forth. Great, now I want you to go as fast as you can. Okay, put those hands in your lap and do it. Great. Can you go ahead and grab both fingers and squeeze as hard as you can? Good. He has bilateral grip strengths that are equal. We're going to go ahead and test range of motion of the neck. Brett, can you, I'm going to put my hand on your face and I want you to push against it, okay? Good. Other side? Great. Good. While I'm here, I'm going to go ahead and feel for the carotid pulses. I'm going to do this one at a time. Carotid pulses are 2+ bilaterally. I will go ahead and auscultate for some carotid bruits. I'm going to use the bell of my stethoscope to do this. I will have the patient take a normal breath, and then I'll have you take a deep breath in and hold it. Great, you want that out. I'm going to go to this side. Okay. Take a breath in and hold it. Great. Brett, I'm going to have you close your eyes, and I'm going to draw something in your hand, if you can tell me what this is.
3.
Great. We're going to do this on the opposite side.
0.
Good. That's testing graphesthesia. Brett, I'm going to have you close your eyes. I'm going to place something in your hand, and I want you to tell me what that object is, okay?
Paperclip.
Great. You can open those eyes. I'm going to place another object in your opposite hand if you can tell me what that is.
Pin.
Great. That's testing sterignosis. At this point, I'm just going to take a look at the patient's chest anteriorly, making sure that there's no use of any accessory muscles, such as use of noting any retractions. Also looking at the skin color. The skin is nice and symmetrical. I don't notice any definitive color changes throughout the chest. I'm going to palpate the chest, making sure that there's no tenderness. When I palpate, I'm going to use the pads of my fingers and the balls of my hand. Brett, if you feel any tenderness, please tell me. Any tenderness? Great. I'm going to go ahead and percuss the chest. I want to make sure that I hear resonant lung sounds throughout. If I notice any dullness, this could signify fluid or air in the lung spaces. I'm going to percuss in a ladder-like motion. Great. All lung sounds are resonant throughout. I'm going to go ahead and auscultate for lung sounds. Lung sounds are clear to auscultation. I don't notice any adventitious breath sounds, which would include wheezing, crackles, or onchi. At this point, we can go ahead and, patient is fairly skinny. I'm going to find the apical impulse, also known as the point of maximal intensity. And I am able to feel that with the fifth intercostal space. If for some reason I suspected an enlarged heart, I could move over a few centimeters. I can feel it right here. We're going to go ahead and assess for heart murmurs. At the second right intercostal border, we have our aortic valve. Left sternal border, second intercostal space, we have our pulmonic valve. Third intercostal space, third intercostal space, left of the sternal border, we have Erb's point. Fourth intercostal space, left of the sternal border, we have tricuspid valve. And fifth intercostal space, midclavicular line, we have the mitral valve, also known as the apex of the heart. When we listen for the heart murmurs, we just want to note a strong S1 and S2. We'll listen to these murmurs with the bell of our stethoscope as well as the diaphragm. Listening without aortic valve, strong S1 and S2 noted. I'm going to go ahead and flip it over to the bell of my stethoscope, seeing if I hear any whooshing sounds. Second intercostal space, left sternal border, pulmonic. Strong S1 and S2. I'll flip over to the bell. No whooshing. Okay. I'll listen for that tricuspid valve. Fourth intercostal space. Left to the sternal border. Strong S1 and S2 heard in all areas where murmurs are auscultated. I did not hear any signs of murmurs in those areas. Alright, Brett, I'm going to have you turn around and we're going to take a look at your posterior back, okay? You can just hang your feet off the side. Okay, turn a little bit. Great. First, I'm just taking a general inspection of the back, making sure that the muscles are symmetric, that I don't see any use of accessory muscles. Breathing is not labored, which I do not see. I'm going to start by palpating the back, making sure there's no signs of tenderness. Any tenderness, Brett?
No.
Okay. We're going to start by percussing the back. I want to make sure once again that all lung sounds are resonant. Any dullness could signify fluid or air within the lung space. We're going to percuss in a ladder-like motion. Great. I'm going to go ahead and listen for lung sounds. abdomen sounds are clear to auscultation. I don't hear any adventitious breath sounds heard. We're going to go ahead and test for pector eloquy, bronchophony, as well egophony, bronchophony, and pector eloquy. Brett, I'm going to have you say E.
E. E. E. E.
Great. I am able to hear the patient say A, E. An abnormal finding is if you could hear A, which I do not hear. Brett, I'm going to have you say 99.
99. 99. 99. 99.
Great. And that's testing for bronchophony. Brett, I'm going to have you whisper a series of words. 1, 2, 3. Okay? Great. And I'm not able to hear him say those words, which is a normal finding. Also going to test for costovertebral angle tenderness. This is located at the 10th rib. Brett, if you have any tenderness, let me know, okay? Any tenderness noted? Good. We can go ahead and test for diaphragmatic excursion by percussion. Brett, I'm going to have you take a deep breath in and blow it out. Great. Breathe normally. Okay, I'm going to have you take another deep breath in and hold it. Great. I'm going to measure the distance between those, which should be 3 to 5 centimeters. You can breathe normally. We're going to go ahead and test for, make sure that the patient has bilateral lung expansion. Brett, if you can take a deep breath in and out. One more time. Great. I'm able to see that my fingers and thumbs raise bilaterally, and it is not asymmetrical, which is good. At this point, I'm just going to go ahead and assess the spine. Brett, if you could lean over just a little bit, as far as you can. Just going to make sure that that spine is symmetric. I don't show any signs of deviation of that spine, which looks good. So Brett, I'm going to have you turn back to the front. I'm going to go ahead and feel for the patient's brachial pulses and radial pulses. You can also go ahead and feel those axillary lymph nodes, making sure that there's no signs of tenderness or enlargement. Any tenderness?
No.
Great. Good. I'm going to have the patient lay back at a 30-degree angle so I can assess the JVD. I'll put your legs up for more comfort. Good. I'm going to take a look at the patient, seeing if I can note the highest area of pulsation. I'm going to have the patient take a look at the opposite wall. Turn your head. Good. We can measure that with a ruler as well as something flat like a note card. We can put that at the sternal angle and measure. Should be with 6 to 8 centimeters. Great, which is in normal limits. Okay, Brett, you can put your head back to normal. I'm going to go ahead and lay you flat, okay? We're going to take a look at your abdomen. Let me go on this side. You comfortable?
Yes.
Okay. I'm just going to inspect the abdomen. I can note the patient is fairly skinny. There's no protrusions. The abdomen, I don't know any pulsations. No signs of masses noted in that abdomen. First, I'm going to auscultate. I am able to hear all vowel sounds in 4 quadrants, which is normal. I'm going to start by percussion. We want the areas of the stomach to have tympany. What we're looking for is areas of dullness, which there might be scattered areas of dullness, but we don't want large areas of dullness. Areas of dullness could include a mass, tumor, things like that. So I want to hear tympany throughout these areas of the stomach. Great. All areas are tympanic. I'm going to go ahead and percuss for the liver. We're going to start up high and then work our way from below. I'm just waiting to hear those areas of dullness so I can measure the liver span. Okay, I'm going to start at the umbilicus and work my way up. Here about the patient's liver is about 7 centimeters, which is normal. I can also go ahead and see if I can palpate for that spleen. I'm unable to hear for that spleen, which is normal in an adult patient. We're going to start by light palpation. Brett, if you have any pain, let me know, okay? Any pain or tenderness?
No.
Okay. We're going to go ahead and do some deep palpation. While I'm here, I'm also going to feel for the liver. I'm going to stick my hand underneath your back. I'm going to have you take a deep breath in and try and relax those stomach muscles. Now blow it out. Great. I am able to feel that liver about 1 centimeter underneath there. Same thing on the opposite side. Take a deep breath in, blow it out. Good. I cannot feel the spleen. Good. While I'm here, I'm going to go ahead and listen for any bruise noted in the aortic area using the bell of my stethoscope. Right underneath that exploit process. I'm going to go ahead and listen for any renal bruise. Iliacs. And femoral. Good. I do not hear any bruise noted. While I'm here, I can also go ahead and palpate the femoral pulse, which is 2+. Great. While I have the patient laying flat, I'm going to go ahead and examine the lower extremities, just noting hair distribution, making sure that there's no signs of edema on those legs, no signs of ulcers, anything like that. Brett, I'm going to go ahead and take your socks off. There we go. Sock off. Once again, just making sure that the hair distribution is normal, no signs of any ulcers. Want to take a look at those heels, making sure there's no abnormalities back there. We're going to go ahead and feel for the popliteal pulses, which are 2+. I'm going to feel for the dorsalis pedis pulses. Great, 2+. 2+, and then posterior tibial pulses. Great. You can also test muscle strength. Brett, can you push against my hands? Great. Can you pull up? Good. Muscle strength is equal on both sides and strong bilaterally. Brett, can you tell me which way I move your toe, up or down?
Up. Down.
Good.
Up. Down.
Good. We're going to go ahead and test for range of motion. I'm going to have the patient do a leg raise. This is for if the patient has any herniated discs. He may experience pain with this. Brett, if you have any pain, let me know.
No. No.
Good. All right. Brett, if you'll just let me have control of your leg, we're going to test some flexibility in range of motion, okay? Flexion, extension, external rotation, internal rotation. Any pain with that?
No.
Great. We're going to do this on the other side, okay? Flexion, extension, internal rotation, external rotation. Any pain, Brett?
No.
Good. At this point, I'm going to go ahead and have the patient sit up. Good. I'm going to go ahead and check for the patient's reflexes. We're going to start by checking the brachial reflex. Good. Good. Check the radial reflex. Just relax. Good. Good. I'm going to let your feet dangle, okay? We're going to check the popliteal. Good. Okay. We're also going to check the Achilles. Patient sitting back up. I'm going to check range of motion of the shoulders. Brett, can you put your arms behind your head? External rotation. Behind your back. Internal rotation. Can you cross your arms? Adduction, and then bring them out. Abduction. Any pain or tenderness? Okay, perfect. I'm also just going to take a look at the wrist, making sure that he has range of motion, no tenderness noted. Taking a look at the hands, making sure there's no sign of any osteoarthritis, rheumatoid arthritis. I can go ahead and check capillary refill. Great. Less than 3 seconds. Once again, just checking range of motion of the wrist, making sure that there's no tenderness. Checking capillary refill. Great. No, fingernails look good. No signs of cyanosis or ridging on those fingernails. I'm going to go ahead and check capillary refill on the toes. Great. Great. At this point, we're going to go ahead and finish with the genitalia and rectal exam. When assessing the patient, I just want to take a general inspection, making sure that there isn't any signs of excoriation, rashes, lesions, checking for external hemorrhoids as well as internal hemorrhoids. When we have the patient, we're always going to explain the procedure. I would bring an assistant in the room with me to have someone in there with me. We'll have the patient lying on the left side and fully explaining the procedure and what's about to occur. I will insert one gloved finger towards the umbilicus, having the patient bear down. I will then rotate my finger clockwise as well as counterclockwise as far as I can. I'm checking the edges, making sure that there's no signs of any nodules, abnormal findings, anything like that. When I palpate the prostate, I want to make sure that that prostate is rubbery and non-tender. Abnormal prostates may feel boggy, tender, things like that. as I'm pulling my glove out, I want to take a look and just make sure that there isn't any signs of fecal matter or blood on the glove. Moving to the genitalia exam, once again, just general inspection. I want to take a look at the scrotum and the testes and those inguinal areas. Making sure, once again, that there's no discharge, excoriation, signs of any abnormal findings. We then want to palpate the spermatic cord, the epididymis, as well as those scrotum, making sure that there's no signs of tenderness, which could signify an infection. I'd have the patient stand up, and we want to really check those inguinal areas, making sure that there's no signs of hernias in there. We will have a gloved finger on, and we will palpate that inguinal ring and have the patient bear down. What we're looking for is anything touching that glove that could signify that the patient may have a hernia. And that will conduct our head to toe assessment. Thank you.